Chapter 9. The Nervous System. First, let's discuss the functions and structure of the nervous system. Let's define some functions of the nervous system. The brain receives messages from receptors all over the body about seeing, hearing, smelling, tasting, and feeling. Example, when you touch something hot, your brain processes that sensation and triggers an immediate response. The brain sends signals to stimulate muscles to contract, enabling movement of body parts. Ask, what part of the brain controls voluntary movement? Answer, motor cortex and the frontal lobe. The brain and spinal cord process sensory input, initiate appropriate responses, and store events in memory for future reference. Example, you remember to avoid touching something hot because the brain stored that experience. The brain uses sensory input to ensure correct levels of gases, fluids, and nutrients, and manages waste processing to maintain homeostasis. Ask, how does the brain know when you need more oxygen? Answer, sensory input from blood oxygen levels triggers respiratory rate adjustments. The brain is responsible for thinking, feeling, understanding, responding, and remembering. Example, your ability to solve a problem or recall a memory demonstrates the brain's cognitive and emotional functions. The central nervous system consists of the brain and spinal cord. The peripheral system is divided into the sensory and motor division. The sensory division is further divided into the visceral sensory division and the somatic sensory division. The motor division is divided into the somatic motor division and the visceral motor division. The visceral motor division is then further divided into the sympathetic and parasympathetic divisions. Here is the figure to show the organization of the nervous system, divided into the CNS, central nervous system, and PNS, peripheral nervous system. What structures make up the CNS? The brain and spinal cord. The CNS is the control center, processing information and coordinating responses. What structures are part of the PNS? All other nerves outside the brain and spinal cord. The PNS connects the CNS to the rest of the body. PNS has two divisions, sensory and motor. The sensory division of the PNS carries messages from sense organs to the brain. Nerves in the sensory division are called afferent nerves, which bring information toward the CNS. For example, when you touch something hot, sensory nerves send that information to your brain. The motor division of the PNS carries messages from the brain to effectors. Nerves in the motor division are called efferent nerves, which carry instructions away from the CNS to trigger action. For example, when your brain decides to move your hand away from a hot surface, motor nerves signal your muscles to act. All right, let's talk about how messages move to and from the brain. It's actually pretty fascinating. You've got sensory input coming to the brain and motor output going from the brain. Now, here's a little trick to help you remember. The acronym SAME. It's simple, but super effective. Let's break it down. Sensory nerves are afferent nerves. What does that mean? Afferent nerves send messages to the brain. Think about when you touch something hot. Those sensory nerves are the ones screaming, "Hey brain, it's hot over here." They carry that information straight to your brain so you can process it. On the other hand, motor nerves are efferent nerves. These send messages from the brain to your muscles and organs, kind of like the brain saying, "Okay, hand, move away from that hot surface now." Efferent nerves are all about action, making sure the body responds appropriately. Here's a little question for you. If you stub your toe, which nerves are involved in making you feel the pain? Right, sensory afferent nerves. And what about the nerves that tell your foot to pull back in response? Yep, those would be the motor efferent nerves. So, anytime you're trying to figure this out, just remember SAME, sensory afferent, motor efferent. It's a neat way to keep it all straight in your head. All right, let's break this down into the sensory and motor divisions of the peripheral nervous system. Each has its own unique job, and understanding them helps us see how the nervous system keeps everything running smoothly. First up, the sensory division. It has two parts, visceral nerves and somatic nerves. Visceral nerves carry signals from the organs in your thoracic and abdominal cavities to the brain. Let's name a few. What are some organs in these cavities? Right. The heart, lungs, stomach, liver. All those essential organs. These nerves let the brain know what's going on inside your body. On the other hand, somatic nerves carry messages from the skin, muscles, bones, and joints to the brain. So, if you step on something sharp, those somatic nerves tell your brain, ouch. Now, let's move to the motor division, which carries messages from the brain to the muscles and organs. The autonomic nervous system is part of the motor division and controls things that happen involuntarily, like your heart beating, glands secreting, and organs like the stomach digesting food. Quick question: what does involuntarily mean? Exactly, it means these functions happen automatically, without you having to think about them. Then there's the somatic motor division, which is under voluntary control. This division carries signals to your skeletal muscles, like when you decide to lift your arm or take a step. So, to sum it up, the sensory division brings messages to the brain. The motor division sends instructions from the brain. And within these divisions, we have specialized systems to handle both automatic and conscious actions. Pretty cool, right? Let's dive into the autonomic nervous system, or ANS, which is all about controlling the functions in your body that happen automatically, things like your heartbeat, digestion, and breathing. You don't have to think about them, they just happen. Pretty amazing, right? The ANS has two divisions that work in tandem to keep your body in balance: the parasympathetic and sympathetic divisions. Parasympathetic division is your body's calming system. Think of it as the rest and digest mode. It slows your heart rate, increases digestion, and helps you relax. For example, after a big meal, the parasympathetic division takes over to help you digest and conserve energy. Sympathetic division is your body's action system. It kicks in during times of stress or excitement. It's often called the fight or flight response because it prepares you to take action. Your heart rate increases, your pupils dilate, and your body directs blood flow to your muscles. For instance, when you're startled or need to react quickly, this division takes charge. Now, here's what's really cool. These two divisions are like a seesaw, balancing each other out. The parasympathetic division calms things down after the sympathetic division revs you up. It's how your body stays in control, no matter the situation. Let's talk about some medical terms that come directly from Latin or Greek. These words form the foundation of medical terminology, and understanding them makes it much easier to learn the language of medicine. First, afferent. This term comes from Latin and means to bring to. In the nervous system, afferent nerves carry sensory information to the brain. Think of them as the incoming messengers. Next, efferent. This is another Latin term, and it means to bring away from. Efferent nerves carry motor signals away from the brain to the muscles and organs. They're the outgoing messengers. Now, let's move on to ganglion. This term is Greek and means swelling. A ganglion is a collection of nerve cell bodies located outside the central nervous system. Here's a quick quiz. What's the plural form of ganglion? Pause. It's ganglia. Next, we have nerve and neuron. Both of these words simply mean nerve and describe the basic building blocks of the nervous system. Finally, let's talk about plexus. This term is Latin and means braid. A plexus is a web-like network of joined nerves. And here's another quiz question. What's the plural form of plexus? Pause. It's plexuses. The nervous system and how it works at the cellular level. The nervous system is made up of neurons, or nerve cells, that send messages, also called stimuli, to other neurons or to receptors in muscles or organs. Each part of a neuron plays a specific role in this process. First, we have the cell body, which is the main part of the neuron. It's like the control center for the cell. Extending from the cell body are dendrites, which are responsible for receiving stimuli from other neurons and transmitting that information back to the cell body. Think of dendrites as the neuron's listening ears. Next, there's the axon, a single nerve fiber that extends from the cell body. It does the opposite of dendrites. It receives stimuli from the cell body and sends those messages on to another neuron or an effector, like a muscle or organ. Now, let's look at how neurons communicate with each other. Use the figure here to locate a synapse. The synapse is the space or junction where communication happens. It's the gap between the axon of one neuron and the dendrite of another neuron, or between a neuron and an effector like a muscle. Messages don't jump across this gap by magic, though they need help. This is where neurotransmitters come in. Neurotransmitters are chemicals that either assist or inhibit the transmission of a stimulus across a synapse. So, the nervous system is all about teamwork. Neurons send and receive messages. Synapses facilitate communication, and neurotransmitters make sure those messages get where they're needed. It's a beautifully orchestrated system that keeps your body running smoothly. Quick question. Can you think of a situation where endorphins might kick in? Right. During exercise or when you're injured, they help you feel less pain and keep going. Amazing, isn't it? All right, let's take a closer look at the neuroglia, the unsung heroes of the nervous system. While neurons are responsible for transmitting signals, neuroglia provide the critical support that allows neurons to function effectively. Think of neuroglia as the maintenance crew, security guards, and supply team all rolled into one. In the CNS, we have four main types of neuroglia, each with a specific job. Astrocytes or star-shaped cells are multitaskers. They form the blood-brain barrier, which acts as a protective shield for the brain. Astrocytes regulate the exchange of nutrients and waste between neurons and blood vessels. They also provide structural support, keeping neurons in place. For example, astrocytes ensure that harmful substances in the blood, like toxins or pathogens, don't reach the brain while allowing essential nutrients to pass through. Oligodendrocytes are responsible for creating the myelin sheath around neurons in the CNS. The myelin sheath is like insulation on electrical wires. It speeds up the transmission of nerve impulses, allowing faster and more efficient communication. A loss of myelin, as seen in conditions like multiple sclerosis, can severely disrupt nerve signaling. Microglia are the CNS's immune defenders. They patrol the brain and spinal cord, looking for infections, damaged cells, or debris. When they detect a problem, microglia spring into action, engulfing and removing harmful substances or dead cells through a process called phagocytosis. Ependymal cells are cells that line the ventricles of the brain and the central canal of the spinal cord. Ependymal cells produce and circulate cerebrospinal fluid, CSF, which cushions and protects the brain and spinal cord, acting like a shock absorber. They also help maintain a stable environment for the CNS by regulating the exchange of substances between the CSF and nervous tissue. Now, let's talk about one of the most important protective features of the nervous system, the blood-brain barrier. This barrier is formed by tightly packed endothelial cells and blood vessels with the help of astrocytes. It serves as a physical shield, protecting the brain and spinal cord from harmful substances like toxins, bacteria, or viruses that circulate in the blood. At the same time, it allows essential substances like oxygen and glucose to pass through to nourish neurons. But here's the challenge. While the blood-brain barrier is excellent at keeping harmful substances out, it can also block helpful substances, like certain medications, from reaching the brain. This poses difficulties when treating conditions like brain infections or tumors. Let's talk about some important abbreviations in the nervous system and why it's essential to understand their meanings. Knowing these abbreviations helps you quickly grasp key concepts and communicate effectively in the medical field. First, BBB. What does BBB stand for? It stands for the blood-brain barrier. The blood-brain barrier is a protective shield that surrounds the brain, preventing harmful substances like toxins, bacteria, and viruses from entering the brain tissue. It's like a security guard for your brain. But here's the interesting part: not everything is kept out. For example, alcohol can pass through the blood-brain barrier, which is why it affects brain function so quickly. So, why is the BBB important? It protects the brain's delicate environment, ensuring neurons can function properly and maintain a stable internal environment. Next, we have CSF. What does CSF stand for? It stands for cerebrospinal fluid. Cerebrospinal fluid is a clear liquid that flows around and inside the brain and spinal cord. It acts as a cushion, protecting these structures from shocks and trauma. But that's not all. CSF also helps deliver nutrients to the brain and spinal cord and removes waste products, keeping the central nervous system healthy. Let's take a moment to talk about gray matter and white matter, two key components of the central nervous system, or CNS. First, did you know that both gray and white matter are found in the CNS? They each have unique roles and structures. Gray matter refers to the regions of the brain and spinal cord that are occupied by dendrites and cell bodies. These areas are where the actual processing of information happens. Think of gray matter as the command center. It's where decisions are made and signals are interpreted. On the other hand, white matter refers to the regions of the brain and spinal cord that are occupied by bundles of axons. These axons are like highways, carrying signals from one part of the nervous system to another. The white color comes from the myelin sheath that insulates these axons, speeding up communication. Here's a quick way to remember the difference. Gray matter is for processing. White matter is for transmitting. Understanding the distinction between gray and white matter helps us appreciate how the brain and spinal cord work together to process information and relay signals throughout the body. Here we have the brain and cranial nerves. Let's explore the structure of the brain and how it's organized into different regions and lobes. The brain is divided into three main portions. First, we have the cerebrum, the largest portion of the brain. It consists of two halves, or hemispheres, and is responsible for complex functions like thought, memory, and voluntary movement. Next, there's the cerebellum, which is smaller and lies inferior to the cerebrum. The cerebellum coordinates skeletal muscle activity to help maintain posture and balance. Finally, there's the brainstem, an elongated portion of the brain. It's located inferior to the cerebrum and anterior to the cerebellum. The brainstem acts as a bridge, connecting the brain to the spinal cord. Now, let's talk about the convolutions of the brain, which give it that wrinkled appearance. These folds consist of sulci, which are the shallow grooves, and gyri, the raised ridges between the sulci. Moving on to the brain's lobes. The frontal lobe is located at the front of the brain and is the largest lobe. It plays a major role in decision-making, voluntary movement, and speech. The parietal lobe, separated by the central sulcus, is located just posterior to the frontal lobe. It's responsible for processing sensory information like touch and temperature. The temporal lobe, separated by the lateral sulcus, lies below the parietal and frontal lobes and is involved in hearing and memory. The occipital lobe is located at the posterior end of the brain and is primarily responsible for vision. Lastly, the cerebellum is located inferior to the occipital and temporal lobes and is crucial for balance and coordination. When you think about how these parts of the brain are organized and work together, it's clear how remarkable the brain is in controlling both simple and complex activities. Each portion and lobe has a specific function, and they all interact seamlessly to keep you moving, thinking, and responding to the world around you. Let's talk about the cerebrum and its fascinating structure. The cerebrum is divided into 4 lobes in each hemisphere of the brain. Each lobe has a specific location and unique set of functions that contribute to everything we do. Take a look at the figure, and as I describe each lobe, try to locate it. I'll also ask you to think about its functions. First, we have the frontal lobe. This lobe is located right behind your forehead. It's the brain's command center and is responsible for a wide range of functions, including memory, intellect, concentration, problem-solving, emotions, and the planning and execution of behavior. Think about it, every decision you make and action you plan starts right here in the frontal lobe. Next is the parietal lobe. This lobe is located above the ear. It's the brain's sensory hub, responsible for receiving and interpreting sensations like pain, pressure, touch, temperature, and awareness of your body parts. Let's pause for a moment. Imagine touching something hot. The parietal lobe processes that information and quickly sends a signal to pull your hand away. Now, let's move to the temporal lobe. It's located just behind the ear. This lobe is all about interpreting sensory experiences, like sounds and spoken words. For example, when you enjoy a song or follow a conversation, your temporal lobe is working hard to process those sounds and give them meaning. Finally, we have the occipital lobe. This lobe is found at the back of the head. Its primary role is to interpret visual images and the written word. Think about reading a book or looking at a painting. Your occipital lobe is the one bringing those visuals to life in your mind. Now, let's review. The frontal lobe handles thinking, memory, and planning. The parietal lobe focuses on sensory input and body awareness. The temporal lobe is your auditory and language processor. And the occipital lobe is all about vision and interpretation. Here's a quick question. Which lobe helps you solve a math problem? That's right, the frontal lobe. And which one processes the sounds of your favorite music? That would be the temporal lobe. Each lobe works together to make the cerebrum a powerhouse of cognitive and sensory processing. Amazing, isn't it? Take a moment to explore some medical terminology that comes directly from Latin or Greek. These terms are foundational in understanding the structure of the brain. First, we have the word cortex. In Latin, cortex means shell. In the brain, it refers to the gray covering of the cerebral hemispheres. This layer is essential for processing information and making sense of the world around us. The plural of cortex is cortices. Repeat that with me, cortices. Next, let's talk about the word gyrus. In Greek, gyrus means circle. It describes one of the many rounded elevations on the surface of the cerebral hemispheres. The plural of gyrus is gyri. Say it with me, gyri. Now, let's move to the word sulcus. Sulcus comes from Latin and means furrow or ditch. A sulcus is a groove on the surface of the cerebral hemispheres. It's what separates one gyrus from another, creating the brain's distinctive ridged appearance. The plural of sulcus is sulci. Let's say it together, sulci. Here's a quick review. The cortex is the gray shell covering the brain, and its plural is cortices. A gyrus is a rounded elevation, and its plural is gyri. A sulcus is a groove, and its plural is sulci. Now, let me ask you a question. What do you think separates the gyri on the brain's surface? That's right, sulci. As we go through, use the figure above to locate each region and think about its specific role. First, the thalamus. The thalamus acts as a messenger center. It receives sensory stimuli from the body and channels them to the correct lobe of the brain for processing. Next, the hypothalamus. This small but mighty region is responsible for regulating critical functions like blood pressure, body temperature, water and electrolyte balance, hunger, body weight, sleep, wakefulness, and even the digestive tract. The hypothalamus is like the brain's thermostat and control panel. It keeps your body running smoothly. Now, let's talk about the basal nuclei. These structures control voluntary muscular movements, posture, emotions, and cognition. For example, when you decide to stand up or smile, the basal nuclei are involved in coordinating those actions. Moving on to the limbic system. This system is where your emotions live. It controls your experiences of fear, anger, pleasure, and sadness. Think of the limbic system as the emotional core of the brain, helps you react to the world around you. Next, the brainstem. The brainstem acts as a relay station for sensory impulses traveling between the body and the brain. It also contains centers that control heart rate, breathing, the diameter of blood vessels, and even waking the cerebrum. Without the brainstem, many automatic functions we rely on simply wouldn't happen. The cerebellum comes next. It coordinates skeletal muscle activity to help you maintain posture and balance. For instance, when you walk or even sit upright, your cerebellum is constantly working to keep you steady. Now let's talk about the ventricles. Deep inside each cerebral hemisphere are spaces called ventricles, which contain cerebrospinal fluid, or CSF. CSF plays a vital role in protecting, cushioning, and providing nutrients to the brain and spinal cord. It's like a safety net and support system all in one. The cranial nerves play a critical role in how the brain communicates with the rest of the body. There are 12 pairs of cranial nerves. Each pair has a unique name and is also designated by a Roman numeral, ranging from I to XII. These nerves are essential for functions like movement, sensation, and even our sense of smell and sight. To make it easier to remember their order, we often use a mnemonic. Take a look at the figure to see how it organizes the cranial nerves. Each cranial nerve is paired and serves a specific function, allowing the brain to directly communicate with different parts of the body. For example, the olfactory nerve handles your sense of smell. The optic nerve is responsible for vision. And the vagus nerve connects to many internal organs, playing a role in heart rate, digestion, and more. Here's something fascinating. Cranial nerves allow for direct communication between the brain and areas like the face, neck, and even internal organs. Unlike spinal nerves, cranial nerves don't pass through the spinal cord, they connect directly to the brain. There are 12 cranial nerves, each with a specific name and Roman numeral. Let's go through them in order, using the figure for reference. Olfactory nerve, or cranial nerve number 1, responsible for your sense of smell. Optic nerve, or cranial nerve number 2, handles your sense of vision. Oculomotor nerve, or cranial nerve number 3, controls most of the muscles that move your eyeballs. Trochlear nerve, or cranial nerve number 4, helps control a single muscle that moves the eye downward and inward. Trigeminal nerve, or cranial nerve number 5, responsible for sensation in the face and controlling the muscles used for chewing. Abducens nerve, or cranial nerve number 6, controls a muscle that moves the eye side to side. Facial nerve, or cranial nerve number 7, manages facial expressions and the sense of taste on the front 2/3 of the tongue. Vestibulocochlear nerve, or cranial nerve number 8, handles hearing and balance. Glossopharyngeal nerve, or cranial nerve number 9, plays a role in swallowing and the sense of taste on the back third of the tongue. Vagus nerve, or cranial nerve number 10, connects to many internal organs and controls functions like heart rate, digestion, and breathing. Accessory nerve, or cranial nerve number 11, controls the muscles used for head and shoulder movements. Hypoglossal nerve, or cranial nerve number 12, manages movements of the tongue. The spinal cord is like a highway, connecting the brain to the rest of the body, and each region serves a specific part. The first region is the cervical spine. This area is responsible for innervating the neck, shoulders, and arms. Think about turning your head or raising your arm. That's all thanks to the cervical spine. Next is the thoracic spine. This region innervates the chest, ribs, vertebral column, and the back muscles. For example, when you take a deep breath or bend backward, the thoracic spine is at work. Now, let's talk about the lumbar spine. This region controls the hips and the front of the legs. Imagine taking a step or flexing your hip. Those movements rely on signals from the lumbar spine. Finally, we have the sacral spine. This region innervates the buttocks, genitals, and the back of the legs. Think about sitting down or feeling sensations in your lower back. These actions are governed by the sacral spine. Let's take a moment to look at these abbreviations, a crucial part of medical terminology. First, let's define CSF. CSF stands for cerebrospinal fluid. This is a clear, protective fluid that flows in and around the brain and spinal cord. It helps cushion these structures, provides nutrients, and removes waste. Think of CSF as the brain and spinal cord's personal support system. Next, we have C1 through C8. These abbreviations refer to the 8 pairs of cervical spinal nerves. These nerves are located in the cervical region of the spinal cord, and they innervate areas like the neck, shoulders, and arms. Now, let's move to T1 through T12. These refer to the 12 pairs of thoracic spinal nerves. They are located in the thoracic region of the spinal cord, and they control the chest, ribs, back muscles, and vertebral column. Next are L1 through L5. These are the 5 pairs of lumbar spinal nerves. They are located in the lumbar region and innervate areas like the hips and the front of the legs. Finally, we have S1 through S5. These refer to the 5 pairs of sacral spinal nerves. They are located in the sacral region and control the buttocks, genitals, and the back of the legs. The meninges, the protective layers that cover the brain and spinal cord. Take a look at the figure to see the 3 layers of meninges clearly illustrated. The dura mater is the outermost layer. It's tough and durable, providing the brain and spinal cord with strong protection. Beneath that is the arachnoid mater, a web-like layer that gets its name from its spider-like appearance. Finally, there's the pia mater, the innermost layer. This delicate layer clings closely to the brain and spinal cord, following every curve and groove. The space between the arachnoid mater and the pia mater is filled with cerebrospinal fluid, or CSF. CSF works hand in hand with the meninges to cushion the brain and protect it from shocks and trauma. Imagine the meninges and CSF as a helmet and padding for your brain working together to keep it safe. Now, let's talk about an important medical procedure, the lumbar puncture, also called a spinal tap. This procedure involves aspirating cerebrospinal fluid from the lower spinal canal to diagnose diseases like infections, bleeding, or neurological disorders. The information obtained from this fluid can be critical for making a diagnosis. Now let's focus on the disorders of the brain and cranial nerves. Dementia is a condition that presents with a collection of signs and symptoms and has many different causes. What are the signs and symptoms of dementia? They often include short-term memory loss, inability to solve problems, confusion, inappropriate behavior, and impaired intellectual functioning. These symptoms can vary from person to person, but they all interfere with daily life and activities. Now, what causes dementia? Some common causes include reactions to medications, hypoglycemia or other metabolic dysfunctions, vitamin deficiencies such as low levels of B12, infections of the brain, including meningitis or encephalitis, emotional problems like depression, which can mimic dementia. Dementia can also occur after a stroke, where parts of the brain are damaged due to a lack of blood flow. The most common form of dementia is Alzheimer's disease. In Alzheimer's, nerve cells in the brain are replaced by clumps of protein, disrupting normal brain function. Use the figure here to see the brain changes typical of Alzheimer's disease. Notice how the brain appears shrunken due to loss of neurons. Another type is vascular dementia. This occurs when the arteries supplying the brain with oxygenated blood become narrowed or blocked, leading to damage in areas of the brain that rely on that blood supply. Let's also discuss related conditions. Confusion is the inability to process information normally, leading to disorientation and difficulty understanding what's happening. Delirium is different. It's a sudden onset of disorientation, inability to think clearly, or trouble paying attention. Here's something important. Not all conditions causing dementia-like symptoms are permanent. Some are treatable. Early diagnosis and treatment can make a significant difference for these conditions. Strokes are a critical condition that occurs when the oxygenated blood supply to the brain is cut off. Strokes are also known as cerebrovascular accidents, or CVAs, when blood flow to the brain is interrupted, brain cells begin to die, leading to serious and often life-threatening symptoms. Strokes can cause a wide range of symptoms, including numbness or weakness, especially on one side of the body, difficulty walking, balance issues, or coordination problems, trouble speaking or understanding speech, vision difficulties, dizziness, confusion, or a severe headache. These symptoms can appear suddenly and require immediate medical attention. Remember, time is critical. There are two main types of strokes. Ischemic strokes. These occur when brain cells die due to a lack of oxygen caused by atherosclerosis, where fatty deposits clog the blood vessels, and embolism, a blood clot or other particle that blocks blood flow, or the occlusion of small cerebral arteries. Use the figure to visualize how arteriosclerosis and embolus can block blood flow and lead to ischemic strokes. Hemorrhagic strokes. These happen when a blood vessel in the brain bursts. Common causes include a ruptured aneurysm, or an arteriovenous malformation that bursts, causing bleeding in the brain. Let's not forget transient ischemic attacks, or TIAs. These are often called small strokes because their symptoms are short-term and resolve within minutes or hours. However, a TIA is a warning sign of a potential major stroke and should never be ignored. Now, let's look at the risk factors for ischemic strokes. Hypertension, diabetes mellitus, hypercholesterolemia, smoking, and obesity are significant contributors. Managing these conditions can greatly reduce the risk of an ischemic stroke. For hemorrhagic strokes, hypertension is again a major factor, along with cerebral arteriovenous malformations and cerebral aneurysms. Let's dive into some important abbreviations and medical terms that are essential to understanding neurological conditions. First, let's define a few common abbreviations. AVM. This stands for arteriovenous malformation. It refers to an abnormal connection between arteries and veins in the brain, which can increase the risk of a stroke. CVA. This is the abbreviation for cerebrovascular accident. A CVA is what we commonly call a stroke, which occurs when blood flow to the brain is interrupted. TIA. This stands for transient ischemic attack. A TIA is often called a mini-stroke, where symptoms are temporary but serve as a warning sign for future strokes. Now, let's break down and define two important terms that describe stroke effects. Hemiparesis. Break it down. Hemi means half. Paresis means weakness. Put it together. Hemiparesis means weakness in either the right or left half of the body. Hemiplegia. Break it down. Hemi means half. Pleg means paralysis. Ia means condition. Put it together. Hemiplegia is a condition of paralysis on either the right or left half of the body. Cerebral palsy, or CP, is a condition that causes motor impairment due to brain damage in an infant or young child. The cause of cerebral palsy isn't always known, but some possible causes include brain malformations during development, maternal use of cocaine, which can disrupt normal brain growth, hypoxia, a lack of oxygen either during birth or in the neonatal period. Cerebral palsy can be classified in two ways: by the number of limbs involved and by the nature of the movement disorder. Classification by movement disorder. Let's start with the movement disorder classification. Ask yourself, how does the disorder affect motion and muscle control? Spastic CP. Muscles are tight and resistant to stretching. When used, these muscles can become overactive and produce clonic movements, rapid, repetitive motions. Athetoid CP. Characterized by involuntary writhing movements and constant, uncontrolled motion. Ataxic CP. Results in a staggering walk and unsteady hands due to poor balance and depth perception. Classification by number of limbs involved. Now, let's look at how cerebral palsy can be classified by the number of limbs affected. Diplegia involves all four limbs, but the legs are often more affected than the arms. Monoplegia affects just one limb, typically an arm. Paraplegia impacts both legs. Quadriplegia involves all four limbs. Triplegia affects 3 limbs. Treatment for CP focuses on improving quality of life and includes physical therapy and speech therapy to enhance movement and communication, muscle relaxant drugs to ease spasticity, mechanical aids such as braces or wheelchairs to assist with mobility. Let's explore epilepsy and narcolepsy, 2 important neurological conditions. Epilepsy, also known as seizure disorder, occurs when clusters of neurons in the brain discharge electrical signals in an abnormal rhythm. Epilepsy can be caused by abnormal brain development, brain damage, which may lead to loss of consciousness and convulsions. Seizures are classified into 2 main types, partial and generalized. Partial seizures. These occur when abnormal activity is isolated to one area of the brain. For example, one limb might jerk or twitch uncontrollably. Generalized seizures. These involve the entire brain and can take several forms. Absence seizures, brief episodes of staring or zoning out. Tonic-clonic seizures, intense muscle contractions followed by jerking movements. Febrile seizures, seizures triggered by high fever, especially in young children. A condition called status epilepticus is a medical emergency. It occurs when a seizure lasts more than 10 minutes, or there are 3 recurrent seizures without the person regaining consciousness in between. Immediate medical attention is crucial in this situation. If someone is experiencing a seizure, here's what you should do. Place the person in a reclining position on their side to keep their airway clear. Cushion their head to prevent injury. Do not restrain their movements or put anything in their mouth. Now, let's talk about narcolepsy. Narcolepsy is a chronic disorder where a person suddenly falls asleep during the day. This can be accompanied by loss of muscle tone, brief episodes of total paralysis, and even hallucinations. Narcolepsy can significantly affect daily life, as the sudden sleep episodes are unpredictable. Here are some additional brain disorders. Parkinson's disease is caused by the degeneration of neurons that produce dopamine, a key neurotransmitter for movement. What are the symptoms and signs of Parkinson's disease? Tremor of the hands, rigidity, a shuffling gait, and a weak voice. Huntington disease, also known as Huntington chorea, is a progressive genetic disorder. What are the symptoms and signs of Huntington disease? Personality changes, jerky and irregular movements, and muscle weakness. The medical term for jerky movements is chorea. Tourette syndrome is characterized by episodes of involuntary, rapid, repetitive movements of individual muscle groups. These are referred to as tic disorders. Brain tumors often originate from metastatic cancers in the lung, breast, skin, or kidney. How are brain tumors treated? Treatment usually involves a combination of surgery, radiotherapy, chemotherapy, and brachytherapy. Headaches are classified into 3 types: vascular headaches, muscular headaches, and inflammatory headaches. The best way to treat headaches is by addressing the underlying cause. Creutzfeldt-Jakob disease is a rare and fatal condition involving rapid deterioration of mental function and difficulty coordinating muscle movements. It's related to mad cow disease. Encephalitis is often viral in nature and most frequently found in the elderly and children. A brain abscess usually results from infections such as sinusitis, otitis media, or mastoiditis. Cerebral edema is the excess accumulation of water in or around the brain. It's associated with conditions like trauma, tumors, inflammation, toxins, ischemia, and malignant hypertension. Syncope is the medical term for fainting or passing out. How should a person with syncope be treated? The person should lie in a reclining position to improve blood flow and help them recover. Traumatic brain injuries, or TBIs, can affect the brain in different ways. Traumatic brain injuries cause damage to the brain and can have varying degrees of severity. One common type of brain injury is a contusion, which refers to a bruised area of the brain caused by impact. Another is a concussion, which is considered a mild head injury. What are the symptoms and signs of a concussion? They often include a feeling of being dazed, a period of confusion, loss of consciousness, and temporary loss of mental ability. Even though concussions are considered mild, they require proper care to avoid long-term effects. Let's clarify some important terms often associated with TBIs. Impairment refers to a deviation from normal function. For example, difficulty concentrating after a concussion. Disability is a restriction in the ability to perform a normal activity of daily living. For instance, difficulty walking or speaking after a brain injury. Handicap is when a disability prevents a person from achieving a normal role in society. This might mean being unable to return to work or participate in certain activities. These distinctions help us better understand the varying impacts of brain injuries. Now, let's talk about shaken baby syndrome, a serious and preventable form of traumatic brain injury. This occurs when a baby is violently shaken, causing their fragile brain to move back and forth inside the skull. Shaken baby syndrome usually affects children younger than 2 years of age and can result in permanent brain damage or even death. It's a reminder of how important it is to handle infants with care and patience. We can focus on disorders of the meninges. A subdural hematoma occurs when there's bleeding into the subdural space, which is located outside the brain. What are the most common causes of subdural hematoma? Closed head injuries from trauma, such as falls or accidents. High-speed activities like roller coaster rides that involve sharp turns, jerks, or whiplash movements. An epidural hematoma refers to the pooling of blood in the epidural space, which is also outside the brain. What's the most common cause of an epidural hematoma? A skull fracture, which often results from significant trauma. A subarachnoid hemorrhage is a spontaneous bleed that occurs in the subarachnoid space. The warning sign? A sudden, severe headache, often described as the worst headache of one's life. This can be followed by nausea and vomiting and requires immediate medical attention. Now, let's talk about meningitis, which is the inflammation of the meninges, the protective layers that cover the brain and spinal cord. What are the two main types or causes of meningitis? Viral meningitis, which is generally less severe. Bacterial meningitis, which can be life-threatening. Here's some good news. Vaccines are available to prevent most causes of meningitis. Lastly, let's discuss meningioma. This is a tumor that originates in the arachnoid mater, one of the layers of the meninges. It's usually benign and slow-growing, but it can still cause complications depending on its location. Let's explore some disorders that affect cranial nerves and how they manifest in the body. These conditions often have unique and recognizable symptoms. Let's start with Bell palsy, a disorder of cranial nerve 7, also known as the facial nerve. What are the common symptoms of Bell palsy? Weakness or paralysis of the facial muscles on one side of the face. Inability to smile, whistle, or grimace. Drooping of the mouth and drooling. Inability to close the eye on the affected side. Take a moment to look at the figure to see how Bell palsy presents visually. Notice the asymmetry in the facial features. It's a hallmark of this condition. Next, let's discuss trigeminal neuralgia, a disorder of cranial nerve V, also called the trigeminal nerve. This condition is also known as tic douloureux and is characterized by severe, intermittent, unilateral shooting pain in the head and face. The pain can be triggered by simple activities like talking, eating, or even touching the face, making it incredibly disruptive to daily life. Now, let's move to Horner syndrome, which affects the sympathetic nerves supplying the face. It's characterized by a classic triad of symptoms: ptosis, or drooping of the eyelid, a small pupil on the affected side, decreased perspiration on the face. These symptoms often indicate an underlying issue, such as a nerve injury or another neurological condition. Here we have disorders of the spinal cord and peripheral nerves. Let's discuss demyelination, a condition that involves the destruction of the myelin sheath, the protective covering around nerve fibers. This sheath is crucial for the smooth and rapid transmission of nerve signals. Demyelination can result from several factors, including inflammation, vitamin deficiencies, such as a lack of vitamin B12, toxins, and certain medications. When the myelin sheath is damaged, it disrupts communication between the brain, spinal cord, and the rest of the body, leading to a range of neurological issues. One condition associated with demyelination is Guillain-Barré syndrome. This disorder is characterized by muscle weakness, loss of nerve conduction, and paresthesias, or abnormal sensations like tingling or numbness. How is Guillain-Barré syndrome treated? With corticosteroids, which help reduce inflammation and manage symptoms. Another condition involving demyelination is multiple sclerosis, or MES. In MES, the nerve fibers in the brain, spinal cord, and optic nerves lose their protective myelin sheath, leading to a range of symptoms such as weakness, vision problems, and difficulty with coordination. The exact cause of MES is unknown, but its effects on the nervous system can be profound. Take a look at the figure to see the destruction of the myelin sheath that is typical in multiple sclerosis. Notice how the exposed nerve fibers can no longer efficiently transmit signals, leading to the symptoms experienced by individuals with MES. Here are some important medical terms that health professionals use frequently. Understanding these terms is essential for clear communication in healthcare settings. First, let's define the terms. Exacerbation. This means an increase in the severity of a disease. For example, during an exacerbation of asthma, a patient might experience severe shortness of breath. Intermittent. This refers to something that alternately ceases and begins again. Think of symptoms like fever or pain that come and go. They are intermittent. Demyelination. This is the process of losing the myelin sheath on a nerve fiber. Without myelin, nerves can't transmit signals efficiently, leading to neurological symptoms. Remission. This means a lessening of the symptoms of a disease. For instance, during remission, a patient with multiple sclerosis may experience fewer or milder symptoms. Now, let's break each term down into its elements to better understand them. Exacerbation. X means out or beyond. Acerb relates to sharpness or severity. Ation indicates a process or condition. Put it together. Exacerbation refers to a condition where symptoms go beyond normal severity. Intermittent. Inter means between. Mit relates to sending or ceasing. Ent indicates a characteristic or action. Together, intermittent describes something that starts and stops repeatedly. Demyelination. De means removal or loss. Myelin refers to the sheath surrounding nerve fibers. Ation again indicates a process. So, demyelination is the process of losing the protective myelin sheath. Remission. Re means back or again. Mission comes from the Latin root for sending. Remission refers to sending symptoms back or reducing their severity. We can focus on disorders of the spinal cord. Injury to the spinal cord results in a loss of function below the site of injury. Both muscle control and sensation are lost, and paralysis is a frequent result. When the spinal cord is severed, the loss of function is permanent. In contrast, a contusion of the spinal cord can cause a temporary loss of function, which may last for days, weeks, or even months. Compression of the spinal cord can occur due to a herniated disc, a tumor in the cord or spine, cancer, or osteoporosis. These conditions place pressure on the spinal cord, disrupting its normal function. Acute transverse myelitis blocks the transmission of impulses up and down the spinal cord. Risk factors for developing this condition include: for injection of amphetamines or heroin, Lyme disease, syphilis, and tuberculosis. Symptoms include loss of sensation, muscle paralysis, and loss of bladder and bowel control. Unfortunately, there is no specific treatment for acute transverse myelitis. Subacute combined degeneration is caused by a vitamin B12 deficiency. Symptoms include weakness, clumsiness, tingling, and loss of the sense of limb position. Treatment involves injections of vitamin B12, which can reverse the condition if caught early. Poliomyelitis, or polio, is an acute infectious disease caused by the poliovirus. Symptoms include muscular paralysis, which may involve the muscles responsible for breathing. The good news is that poliomyelitis can be prevented through vaccination. However, some people experience post-polio syndrome years after recovering from polio. This syndrome is characterized by tired, painful, and weak muscles. Finally, let's discuss amyotrophic lateral sclerosis, also known as Lou Gehrig disease. This is a progressive neurological condition for which, sadly, there is no cure. Let's take a moment to review some important abbreviations commonly used in discussing neurological conditions. Understanding these terms is essential for effective communication in healthcare. ALS. This stands for amyotrophic lateral sclerosis. ALS, also known as Lou Gehrig disease, is a progressive neurological disorder that affects motor neurons, leading to muscle weakness and loss of function. MIS. MIS stands for multiple sclerosis. This is a condition characterized by demyelination of nerve fibers in the brain, spinal cord, and optic nerves, disrupting nerve signal transmission. Polio. Polio is short for poliomyelitis. This is an acute infectious disease caused by the poliovirus, leading to muscular paralysis and, in severe cases, respiratory failure. PPS. PPS is the abbreviation for post-polio syndrome. This condition occurs years after recovery from poliomyelitis and is characterized by tired, painful, and weak muscles. SCI. SCI stands for spinal cord injuries. These injuries can result in loss of function below the site of injury, affecting both sensation and muscle control. Let's focus on differentiating similar words, a skill that's essential for understanding and using medical terminology correctly. These words may seem similar, but have distinct meanings and uses. First, let's compare hernia, herniate, and herniation. All three terms relate to an anatomical structure protruding from its normal location. Hernia is a noun that describes the condition itself. For example, the patient has an abdominal hernia. Herniation is also a noun, describing the process or result of a structure protruding. For instance, herniation of the intervertebral disc was observed. Herniate is a verb, meaning the action of protrusion occurring. You might say, the disc may herniate under pressure. So, remember, hernia and herniation are nouns. Herniate is a verb. Next, let's look at paralysis, paralytic, and paralyze. These terms all relate to the loss of voluntary movement of a structure. Paralysis is a noun, referring to the condition itself. For example, the patient suffers from paralysis in both legs. Paralytic is an adjective, describing something related to or affected by paralysis. For instance, the patient exhibits paralytic symptoms. Paralyze is a verb, meaning the act of causing paralysis. You might say, the injury could paralyze the affected limb. So here's the key. Paralysis is a noun. Paralytic is an adjective. Paralyze is the verb. Let's explore neuropathy and related conditions that affect the peripheral nerves. These disorders can cause a wide range of symptoms, depending on the nerves involved. Neuropathy refers to any disorder or disease that affects the peripheral nerves. When a single peripheral nerve is affected, it's called mononeuropathy. An example is carpal tunnel syndrome. which occurs when the median nerve in the wrist is compressed, often from repetitive wrist movements. What are the symptoms and signs of carpal tunnel syndrome? Numbness and pain, and a tingling sensation. Another example of mononeuropathy is ulnar nerve palsy. This happens when the ulnar nerve, the nerve responsible for the sharp pain when you hit your funny bone, becomes damaged. Symptoms include a pins and needles sensation and hand weakness. Peroneal nerve palsy occurs when the peroneal nerve, located at the back of the knee, is compressed. This often happens in people who are bedridden or confined to a wheelchair. When many peripheral nerves throughout the body are affected, it's called polyneuropathy. What are the symptoms and signs of polyneuropathy? Muscle weakness, loss of sensation, and a pins and needles sensation. Let's talk about herpes zoster, also known as shingles. This is a viral illness caused by the same virus as chickenpox. It leads to a painful rash, often in a band-like pattern on one side of the body. Use the figure to see what the rash typically looks like. It's a key sign of herpes zoster. After shingles has subsided, some people experience postherpetic neuralgia, which is a debilitating, hard-to-treat pain that can persist long after the rash disappears. Let's talk about neuromuscular junction disorders, which occur where nerves meet muscles and interfere with the neurotransmitter acetylcholine. These disorders can significantly impact muscle function and overall mobility. One example is myasthenia gravis, a chronic condition characterized by drooping eyelids, weak eye muscles, difficulty talking and swallowing, and muscle weakness in the limbs. This condition highlights how critical the neuromuscular junction is for everyday actions like speaking, eating, and movement. Next, let's discuss botulism, which is caused by food poisoning. The bacteria responsible, Clostridium botulinum, produces toxins that paralyze muscles. Here's an interesting fact. The same bacteria that causes botulism is also used in cosmetic procedures. Botox, made from Clostridium botulinum, is injected into specific muscles to prevent wrinkles by temporarily paralyzing them. Insecticides and nerve gases. Certain insecticides and nerve gases can also damage the neuromuscular junction by interfering with acetylcholine, causing severe and potentially life-threatening effects. Finally, let's talk about nerve compression. This occurs when the space around a nerve is constricted, leading to pain and other symptoms. A common example is sciatica, where the sciatic nerve is compressed, causing pain that radiates down the back of the leg. Let's talk about congenital anomalies of the nervous system, conditions that are present at birth and often develop during the earliest stages of pregnancy. The word congenital simply means born with. Many of these anomalies develop during the first 8 to 10 weeks of gestation, when the nervous system is in its earliest and most critical stages of development. This period is vital because most devastating congenital anomalies of the nervous system occur within this time frame. Ultrasonography and amniocentesis are two key diagnostic tools used to detect these anomalies. Ultrasonography uses sound waves to create images of the developing fetus. Amniocentesis involves sampling the amniotic fluid to check for genetic or developmental issues. These tools provide crucial information about the baby's health and development. The term gestation refers to pregnancy, the period during which a fetus develops in the womb. During the first 10 weeks of gestation, the fetus is particularly vulnerable to external agents. A teratogen is an agent that can cause malformation of an embryo or fetus. Teratogens can include substances like drugs, alcohol, certain infections, or environmental toxins. Their effects are most severe during the early stages of pregnancy, making this a critical time for fetal health. Congenital anomalies of the nervous system highlight the importance of early pregnancy in fetal development. Tools like ultrasonography and amniocentesis help detect these conditions, while understanding terms like teratogen and gestation provides a clearer picture of fetal health. Let's take a closer look at some serious congenital anomalies of the nervous system. These conditions affect the development of the brain, and can have profound impacts. Anencephaly is a condition that occurs when a fetus does not develop cerebral hemispheres. This condition prevents the brain from forming fully, resulting in a non-viable pregnancy or severe developmental limitations. Next, we have microcephaly. This condition is associated with small cerebral hemispheres and a decreased head size. Infants with microcephaly often experience developmental delays and neurological impairments. Now, let's talk about hydrocephalus. This condition is characterized by enlarged cerebral ventricles, excessive cerebrospinal fluid, and an increased head size. Take a moment to look at the figure, which illustrates the characteristic enlargement of the head seen in hydrocephalus. This occurs because the accumulation of CSF puts pressure on the developing brain, causing the skull to expand. Let's discuss two significant congenital conditions that affect the nervous system: fetal alcohol syndrome and spina bifida. Understanding these conditions is critical for identifying their impacts and potential preventive measures. Fetal alcohol syndrome is the third most common cause of mental retardation in newborns. It occurs when a pregnant woman drinks alcohol, which disrupts the normal development of the baby's brain and body. Take a moment to look at the figure to see the distinct facial characteristics associated with fetal alcohol syndrome. These include a smooth philtrum, thin upper lip, and small eye openings. Now, let's focus on spina bifida, a condition that occurs in the lumbar and sacral regions of the spinal cord. Spina bifida results from a malformation of the vertebral arch and spinal cord during early development. In spina bifida cystica, the vertebral arch is absent, causing the meninges and spinal cord to protrude outward. There are two main types of protrusions associated with spina bifida. Meningocele. This involves the protrusion of the meninges only. Meningomyelocele. This involves the protrusion of both the meninges and the spinal cord. It's the more severe form, often leading to significant neurological impairments. The exact cause of spina bifida is not known, but research suggests it may be related to a deficiency in folic acid. Here's a key preventive measure. Women planning to become pregnant, or those in the early stages of pregnancy, should take folic acid supplements to help reduce the risk of spina bifida. Let's focus on procedures and pharmacology. Let's discuss the diagnostic tools used to evaluate and identify neurological conditions. These procedures provide critical insights into the health and function of the brain and spine. A lumbar puncture, also known as a spinal tap, is performed to remove cerebrospinal fluid for analysis. This procedure helps diagnose conditions such as infections, bleeding, or neurological disorders. Electroencephalography, or EEG, records the electrical activity of the brain. It is commonly used to diagnose seizure disorders, sleep disturbances, and brain damage. Computed tomography generates images of slices of the brain to diagnose brain tumors, ischemia, and birth defects. This imaging technique is invaluable for quickly assessing conditions requiring urgent care. Magnetic resonance imaging, or MRI, produces highly detailed pictures of the brain and spine. It is used to diagnose strokes, tumors, and myelin sheath damage. One significant advantage of MRI is that it does not expose the patient to radiation. Magnetic resonance angiography uses dye to produce detailed images of the blood vessels in the head and neck. This helps assess blood flow and detect abnormalities like blockages or aneurysms. Cerebral angiography is another diagnostic tool that uses dye to produce images of blocked blood vessels, aneurysms, or malformations. Cerebral arteriography is particularly useful for determining the site of bleeding and hemorrhagic strokes. Finally, color Doppler ultrasonography uses ultrasound to evaluate transient ischemic attacks and the risk of strokes. Let's explore some advanced diagnostic techniques used to evaluate brain and nervous system function. These tools help provide crucial insights into neurological health. Echoencephalography uses ultrasound to produce images of the brain, primarily in children under the age of 2. This technique is especially useful because the soft spots, or fontanelles, in an infant's skull allow sound waves to penetrate easily. Positron emission tomography, or PET, involves attaching radioactive molecules to substances necessary for brain function, such as glucose. This imaging technique provides valuable information about brain metabolism and helps diagnose conditions like tumors or neurodegenerative diseases. Myelography combines the use of dye with X-rays to evaluate the spinal cord. It is used to diagnose spinal cord disorders, such as herniated discs or tumors, by highlighting the spaces around the cord. Evoked responses evaluate brain function by using sensory stimuli to activate specific areas of the brain. For example, visual, auditory, or tactile stimuli can be used to assess how well the brain processes these inputs. Electromyography, or EMG, provides information about muscle disorders, peripheral nerve issues, and problems at the neuromuscular junction. This test involves inserting small needles into muscles to measure their electrical activity during rest and movement. Nerve conduction studies measure the speed at which nerves conduct impulses to and from the brain. These studies help identify conditions such as nerve damage or neuropathy. Let's review some important abbreviations commonly used in discussing diagnostic tools and neurological conditions. CSF stands for cerebrospinal fluid. CSF surrounds the brain and spinal cord, providing protection, cushioning, and nutritional support. CT stands for computed tomography. This imaging technique generates detailed slices of the brain, helping to diagnose conditions like tumors, ischemia, or birth defects. EEG stands for electroencephalography. This test records the brain's electrical activity and is often used to diagnose seizure disorders, sleep disturbances, or brain damage. FAS is short for fetal alcohol syndrome. This condition occurs when a pregnant woman drinks alcohol, leading to mental and physical developmental issues in the baby. MRI stands for magnetic resonance imaging. It produces highly detailed images of the brain and spine without exposing the patient to radiation. It's commonly used to detect strokes, tumors, or myelin sheath damage. PET stands for positron emission tomography. This scan uses radioactive molecules to evaluate brain function, particularly metabolism and blood flow. Here are some key surgical and medical procedures used in the treatment of neurological conditions. A craniotomy involves the surgical removal of part of the skull bone to expose the brain for surgery. This is often performed to address conditions like tumors, aneurysms, or traumatic brain injuries. Following a craniotomy, a cranioplasty may be required. This procedure repairs a bone defect in the skull, restoring its shape and protection. Microvascular decompression is a surgery to relieve pressure on a cranial nerve caused by an artery or vein. It's often used to treat conditions like trigeminal neuralgia or hemifacial spasms. Deep brain stimulation involves the placement of electrodes deep into specific areas of the brain. These electrodes deliver electrical stimulation to help manage conditions such as Parkinson's disease or essential tremor. This surgery removes pituitary tumors using an approach through the inside of the nose. This minimally invasive technique avoids external incisions and reduces recovery time. Endovascular coiling is a procedure that blocks blood flow to an aneurysm, preventing it from rupturing. A catheter is used to place tiny coils inside the aneurysm, promoting clot formation. Flow diversion uses stents placed via a catheter to maintain blood flow through a blood vessel where a blockage or aneurysm has occurred. This technique redirects blood flow away from the aneurysm, reducing the risk of rupture. TPA is a clot-busting medication used for acute ischemic stroke. Timing is critical. It must be given within 4 hours of symptom onset to be effective. A carotid endarterectomy is performed when a carotid artery is significantly occluded with plaque. This procedure removes the plaque, reducing the risk of stroke. A shunt is used to treat hydrocephalus, draining excess cerebrospinal fluid, CSF, from the ventricles to another area of the body, such as the abdomen. Botulinum toxin injections, commonly known as Botox, are used to treat migraines and spasticity. Cerebral palsy is a motor impairment disorder that results from damage to the developing brain. While there's no cure, treatment focuses on managing symptoms and maximizing function. Key components of treatment include physical therapy to improve mobility, strength, and coordination, speech therapy to address communication challenges, occupational therapy to enhance daily living skills, medications such as muscle relaxants or antispasmodics to reduce muscle stiffness and spasms, orthopedic interventions like braces or surgery to correct deformities and improve mobility. In some cases, surgical interventions like selective dorsal rhizotomy may be used to reduce spasticity by targeting specific nerve roots. Gliomas are tumors that arise from the glial cells in the brain or spinal cord. Treatment for gliomas depends on factors like the tumor type, size, location, and grade. Common approaches include surgery, radiation therapy, and chemotherapy. For surgery, the goal is to remove as much of the tumor as possible without damaging healthy brain tissue. For some gliomas, surgery may be the primary treatment. Radiation therapy is often used after surgery to target remaining tumor cells, or when surgery isn't feasible. Chemotherapy uses medications to destroy or slow the growth of tumor cells. Temozolomide is a common chemotherapeutic drug used for glioblastomas, a high-grade form of glioma. Let's explore common drug categories that affect the nervous system. These substances can stimulate, sedate, or depress neurological activity, each with distinct effects on the body and brain. Stimulants work by stimulating the nervous system and causing the release of dopamine, a neurotransmitter associated with pleasurable effects. Examples of stimulants include caffeine, nicotine, amphetamines, and cocaine. These substances can increase alertness, energy, and focus, but often come with risks, such as dependency or overuse. Sedatives are used to quiet nervous excitement and induce sleep. Common examples include alcohol, barbiturates, and meprobamate. Sedatives are effective for calming the nervous system, but must be used cautiously due to the potential for abuse or overdose. Inhaled anesthetics are more powerful than sedatives, but act in a similar manner. These substances are often used in medical settings to induce a deep state of unconsciousness for surgery. Opiates work by depressing sensory nerve pathways to reduce pain. They also depress areas of the brain that control coughing, breathing, and intestinal motility. Examples of opiates include morphine, codeine, heroin, methadone, and oxycodone. While effective for pain relief, opiates come with a high risk of addiction and side effects. Opiate antagonists are medications that prevent opiate actions and are used to treat drug overdoses. Examples include naloxone, often known as Narcan, which rapidly reverses the effects of opiates, and naltrexone, which is used for long-term management of opiate addiction. Let's continue exploring drugs that affect the nervous system, focusing on tranquilizers, antidepressants, psychedelics, marijuana, and antiepileptics. Each of these substances interacts with the brain in unique ways. Tranquilizers act like sedatives, but do not induce sleep. These medications help reduce anxiety and promote calmness. Common examples include Librium, Valium, and Xanax. Antidepressants work by increasing the amount of serotonin at the synapses, improving mood and emotional stability. Examples of antidepressants include Zoloft and Prozac. These medications are often prescribed for conditions like depression and anxiety disorders. Psychedelics are substances that distort perception, mood, and thought. Common examples include ecstasy, or MDMA, angel dust, or PCP, and acid, or LSD. These drugs alter brain function significantly, often leading to hallucinations and a distorted sense of reality. Marijuana is a unique substance with multiple effects. It produces the drowsiness of sedatives. It has the pain-dulling effects of opiates. And at high doses, it can cause the perception distortions of psychedelics. Antiepileptics prevent stimuli from passing across the synapse, reducing the risk of seizures. Common antiepileptic medications include phenytoin and carbamazepine. These drugs are critical for managing epilepsy and other seizure disorders. Here are some abbreviations associated with substances that affect the nervous system. LSD. This stands for lysergic acid diethylamide, commonly known as acid. LSD is a psychedelic substance that distorts perception and alters mood and thought. MDMA is the abbreviation for methylene dioxymethamphetamine, commonly known as ecstasy. MDMA is a synthetic drug that produces both stimulant and psychedelic effects. PCP stands for phencyclidine, often referred to as angel dust. PCP is a dissociative drug that alters sensory perception and can cause hallucinations. THC is short for tetrahydrocannabinol, the active ingredient in marijuana. THC is responsible for marijuana's psychoactive effects, including altered perception and relaxation. Medication is the cornerstone of pain management, addressing various types and levels of discomfort. Pain management has become so specialized that it is now a board-certified specialty for anesthesiologists. There are 3 levels of pain severity: mild, moderate, and severe. Treatment approaches differ based on these levels. Let's break them down. For mild pain, treatments typically involve analgesics or NSAIDs. For moderate pain, treatment may escalate to opiates or opiate combinations. For severe pain, higher doses of opiates are often required. For pain originating in the spine, interventional pain management techniques are increasingly used. These include epidural nerve blocks, facet nerve blocks, radiofrequency nerve ablation, cryoneurolysis, and spinal infusion pumps. These methods target specific nerves to provide relief and improve mobility. Phantom pain occurs following the amputation of a limb and is experienced as if the limb is still present. Referred pain is visceral pain felt in a location other than where the pain originates. For example, heart pain might be felt in the shoulder or arm. Take a look at the figure to see common sites of referred pain and their associated origins. Here are some important root elements and their meanings. Ner means nerve. Seize means to grab or convulse. Sens means to feel. Surg means to operate. Tan means pressure or tension. Diagnosed means decision. Elector means electricity. Encephal means brain. Epilept means seizure. Now, let's use these roots to form medical terms. For diagnosed, words. Diagnosis is the act of making a decision, and diagnostic is pertaining to a decision. For elector, words. Electrocardiogram is a recording of the heart's electrical activity. Electrocardiograph is the instrument used to make the recording, and electrocardiography is the process of making the recording. For elector plus encephal, words. Electroencephalogram is a recording of the brain's electrical activity. Electroencephalograph is the instrument used for recording, and electroencephalography is the process of making the recording. For epilept, words. Epileptic is pertaining to seizures. Epilepsy is the condition of having recurrent seizures, and antiepileptic is a medication used to treat seizures. Lastly, let's review some important abbreviations commonly used in the study of the nervous system and related medical conditions. EG stands for electroencephalogram, which records the brain's electrical activity. CNS, the abbreviation for central nervous system, which includes the brain and spinal cord. CT stands for computed tomography, an imaging technique that produces detailed slices of the body. MRI stands for magnetic resonance imaging, which generates detailed images of the brain and spine without radiation. PNS, the abbreviation for Peripheral Nervous System, which includes all nerves outside the CNS. BSE stands for bovine spongiform encephalopathy, commonly known as mad cow disease. CJD means Creutzfeldt-Jakob disease, a rare and fatal brain disorder. NMS stands for neurally mediated syncope, a condition causing fainting due to abnormal nerve signals. TB means tuberculosis, which can cause a brain abscess in some cases. ADLs stands for activities of daily living, such as bathing, dressing, and eating. SBS, the abbreviation for shaken baby syndrome, a condition caused by violent shaking of an infant. TBI stands for traumatic brain injury, which results from a blow or jolt to the head. 4 means intravenous, referring to medication or fluids administered directly into a vein. NSAID, the abbreviation for nonsteroidal anti-inflammatory drug, commonly used to reduce pain and inflammation. RF stands for radiofrequency, a technique often used in interventional pain management.